Uh-huh. Yes, ma'am. Yes, ma'am. Uh-huh. Okay. Uh-huh. In your entire screen, application window, and Chrome tab. Okay. Oh, yep, I see it now. Yep. I don't think I had it. Uh-huh. Perfect. Then when I go back to it, I can see it. So then how do I change it in the midst of the while I'm talking? Uh-huh. Yes, ma'am. Uh-huh. Okay. All righty. Thank you so much for your help. I appreciate it. All right. Bye-bye. You too. Thank you. Bye. That's good. Keeping it out. So I have this pulled up where it's me on one side and my PowerPoint on the other, but I can't figure out how to be like in full blown share mode. You know how it looked like from the beginning of the PowerPoint. And she said leave this up. And even when I do this like from current slide, it's gonna go like this. So then I got to escape back out of it to get to this. And then this is what it shows us. They're in that one right now. This was.
Are you recording this?
It probably is. They automatically do that. Let's do this.
What's this?
I still don't know how to get that advance to the next slides.
Oh. Okay. Alright. You should be able to get your arrow keys. That's all you do. Yes, right.
Maybe so.
Thank you so much again. And I want to invite you to join us for the next presentation, talk about so there again.
I was just going to introduce the speaker. Oh, you trying to get in?
It's recording, but I can't figure out how to put it like normal, like the PowerPoint mode to look like this. And I called him, and what she told me to do still didn't work. And then it goes here. So then how will I see the other stuff? Oh, shoot. All my speakers just did it like that so far.
What you're gonna have to do is, while you talking,
Just pull PowerPoint up.
yeah,
Okay.
and then you're gonna be looking, cause so they can see the way you are looking.
Okay. I think another group did it from 2 different computers.
Mm-hmm. Is it sharing?
This one, my middle one is.
No, it's this one right here for your share screen, and you want to share,
Just that application.
and you want to share your.
No, it's not even showing.
Okay. in the beginning. My share screen worked perfect while ago. Is that it?
That's that.
All right.
And then once I
Share.
start, I'll just have to start back. Okay, I gotcha.
And then you go here.
Mm-hmm.
And okay, hold on. We want to do here. And then whenever you try to get to here, that's what's gonna
Once I
happen.
start, I'll just leave it saved on my PowerPoint.
Mm-hmm.
Okay, sounds good. I think it did help with them having multiple logins.
Mm-hmm. Yep. Log in over here on that computer.
I was logged in.
I got my speaker talking.
Oh, no, I'm ready.
Yeah, you gotta make sure you in Chrome or Firefox. I had a doctor giving a speak from Wake Forest, and he was. You got a camera on? Oh, right here. Okay. Share your audio and video.
I don't have to do that on this side, right?
Do it on that side because you want to talk on this side. Won't let you share audio and video. Because there's no camera or.
It's fine. I'll just do it like that.
Okay. Because I was trying to say pull PowerPoint off over there and then talk on this. You know what I'm saying? Look, pull it up right quick and say I can see what it shows a bit thing. It's still.
It is.
Yeah. Okay.
Okay, good.
So it'll show.
Thank you, ma'am.
Mm-hmm.
What time do you start?
11:10.
Oh, okay.
That's fine.
Yeah, I was on the phone for his session. Well, it was a person talking before him. And they was almost finished and I'm still on the phone trying to get him there. In about 15 minutes, it was like dead silence. I'm like, I apologize. I'm trying to get Dr. Sanders in.
Okay, I'm gonna go ahead and get started. I think Tina's running behind on another session. So my session is gonna be on safe sleep, infant mortality, and how it links to safe sleep in rural Eastern North Carolina. Our project team consisted of myself, Nicole Barnes, and I'm from Martin Terrell, Washington District Health Department. Kirsten Smith, she as well is from this health department, and then Heather Bradley, and she's from Transylvania Public Health Department. And they were not able to be with us today. Kirsten is actually out on maternity leave, so it's just me. Let's see. So for infant mortality, for statistics in 2017, we're a 3-county district. So the ones that I pinpointed were Martin, Terrell, and Washington counties. Martin County was 12.1%, Washington County 22.4%. Terrell County was 0%, but since it still is in our district, we still concentrated on the 3 counties. And then you can look at the national average, which is 6.7%. So as you can see for Martin and Washington counties, they are at least double. See methods for this project. This was to build from an existing project that we had going on here in Martin, Terrell, Washington counties. The purpose was to replicate initiatives in an adjoining county such as Transylvania County. From the project initiated by us here at the health department, those of us who had been involved with this had identified initiatives to educate young mothers on safe sleep and safe sleep environments in our 3 Tier 1 counties and across North Carolina. So who qualifies? That would definitely be our current prenatal patients and then current child health patients. Hey, Tina, they told me to go ahead and get started without you.
Yes, I understand that. I'm so sorry. The other session ran over, but just keep going, Nicole, and we'll wrap it up afterwards. So that's fine.
Sounds good. So who qualifies? It would be our current prenatal patients and then obviously our current child health patients. Since this program concentrates solely on a pack and play, it would be 1 and under just for safety measures. Parents are asked what their child's current sleep environment is or what their planned sleep environment is if they're currently expecting. If the child's environment is not safe, then we'll educate them on what a safe sleep environment is, and then they will receive a pack and play with educational material as well. So our project team developed a questionnaire, just something that was extremely simple. A lot of you work in health departments and know that patients are not looking forward to filling out a long, extensive survey. So just something really brief so we could capture it and they would be interested in completing it. This is used by our maternal health nurses, child health nurses, our providers, OBCM, CC4C nurses, and social workers to determine if expecting mothers or infants are eligible for this program. This is what the education material and the pack and play kind of look like as a package. As you can see, it includes a pack and play, a Halo safe sleep sack, a crib cover, mattress cover, and then some information on safe sleep, and then a children's book that still kind of relates to safe sleep. And how did we reach participants? As a 3-county district health department, we work as a team. Any employee who encounters a prenatal or child health patient is aware of the program and goes over the current or planned sleep environment. Staff would include that would be involved in this would be WIC clerks, nutritionists, clinic nurses, OBCM nurses, CC4C social workers, etc. And then as far as educating the patient, we also, with COVID, we intended on doing classes and kind of having a sit-down discussion and going over things like this, but of course we couldn't do any of that. So we did really good. This was actually included on the questionnaire, just kind of going over the basics, making sure that they know to lay their baby on his or her back to reduce the risk of SIDS. We know that stuffed animals, bumpers, and all those cute accessories make a baby's crib seem warm and cozy. Unfortunately, they can often do more harm than good. Soft bedding can block a baby's airway. During sleep, a firm mattress covered with a tight-fitting crib sheet is all you need to make your baby sleep like a baby. If you're worried about keeping your baby warm on those cold nights, our package actually included this sleep sack that they're talking about, and they actually go from sizes of newborn up until, I've known 3 or 4-year-olds that use them instead of a blanket, so that it's zipped and their arms are hanging out and there's no way it could possibly cover their face. And then, little things like this that I think a lot of people are hands-on. If you can fit a soda can between the slats of a crib, that means your child's head, hand, or foot could get stuck. That's just kind of a good way to judge. Make sure the mattress is firm and fits snugly. Otherwise, a child could get stuck between the gaps. Cover it with a crib sheet with nothing else, just a crib sheet. Babies should not sleep on bed sofas, recliners, chairs, soft surfaces, bouncy chairs, or baby swings. If this happens, make sure to return the baby to the safe sleep environment, such as the pack and play. And then we also tell all new parents they definitely should take CPR. And so who funds this program? We are extremely grateful for this. Prior to the Emerging Leaders in Public Health Program, Martin Terrell Washington District Health Department received the Ann Wolf Mini Grant to explore ways to educate mothers on the importance of safe sleep. So our project team consisted of representatives from Martin, Terrell, and Washington counties in Transylvania County. So there was an opportunity to leverage the work of Transylvania County to this project to explore sleep-related deaths in Transylvania County. We also used our, every health department has a child fatalities team that serves counties, so even Transylvania, Martin, Terrell, and Washington. I serve on the one here in Washington County. We reviewed child deaths up until their 21st birthday. So, obviously, reviewing child deaths, we see a lot of things that would affect safe sleep, could have affected it. They could still be alive. So we also could incorporate Transylvania County in that project as well, because Heather is one of their pregnancy care managers there. And that is all I have. Safe sleep in children is truly a passion of mine, so I'm excited to continue this program here in our health department, and it was nice to kind of tie it with another county as well with our 3 counties.
Thank you so much, Nicole, for that presentation. And I have time, so that is wonderful. And I want to invite anyone in the audience if they have a question. And as we monitor that, thank you again for the work that you and Heather and Kirsten together did for this project. It's another one of those really important topics that we need to keep focus on. In your project write-up, and again to the audience, we posted the link to the project write-ups in the chat box. But in your project write-up, you actually, the infant mortality in Terrell County was 0%, if I'm not mistaken.
That's correct.
What do you think is the difference? What happens in Terrell County that impacts that number?
Unfortunately, I can't say that they're truly educated on safe sleep, and that's why their rate is 0%. I think it's just because it's a small county, and there probably is not a lot of births in that county, whereas Martin and Washington County are our bigger areas. I was still shocked to see that it was 0%. And the Terrell County child fatality team, I don't serve on that, but I do know they don't get a lot of deaths, especially for 21 and under for their child fatality team. So that's definitely a good thing. They may have one every other year, something like that, whereas Washington and Martin County have them pretty often. But I was very shocked. I really was.
If that has anything to do, you were mentioning the socioeconomic factors. Is that something that might impact, or do you think what would your, just based on your experience, you have a lot of experience with this, and you're working in the midst of it, and you're passionate about it. What are your thoughts when you look at what the differences are between those counties?
I mean, it helps us that Terrell County is so small, so maybe we are able to educate those mothers that are there, whereas Martin and Washington counties, there's multiple different pediatric practices, not just us in Terrell County. It's either the medical center or the health department, so they're not going anywhere else. The majority of the time, they can't commute anywhere else. So it's just a larger population to get your hands on and truly educate in Martin and Washington counties, and that's a project we continue to plan on doing. We don't plan to, obviously funds are something that is a big importance for this project, but we still have back in place, and we're still planning on educating new moms on the importance of safe sleep, especially in all three counties.
I understand that you've done a really good job trying to reach the mothers where you can, correct? So even the dental clinics, can you talk a little bit more about that?
Yeah, so here at the health department, we're a 3-county district, and we also have a dental clinic. So obviously, vice versa, anybody that's seen in the clinic is referred to dental. Anybody seen in dental potentially could be referred to our clinics. So they just try to really concentrate on anybody that will qualify for this program to make sure they're referred. The traffic has kind of decreased a little bit in both dental and in the clinic setting because of COVID, but our employees are well educated on safe sleep, and they know exactly what to look for. Even our OBCM and pregnancy care managers, they may be dealing with a new mom or an expecting mom, and ask them, what their current sleep environment is planned for, or what the current one is, and they're able to refer them to this program and educate them on safe sleep, which I think is very important. I have actually had several moms that are expecting twins, and they didn't have anywhere for their child to sleep. They were just planning on the bed or the floor or couch or things like that. So it does my heart good to know that they're getting a safe place for their newborns to sleep.
Absolutely. And Pam, I agree with your comment there about the list of educational items and how those were understandable in terms of I reacted to the soda can too, and I wish I'd known that, but my kids were in the crib. What are your thoughts around, or rather, what have you done any community outreach, and if so, what does that look like, or are you planning to do any community outreach?
Our community outreach kind of did get halted a little bit because of COVID. We actually received the Ann Wolf mini grant again this year, and we're still concentrating on infant mortality, but it's just going to not be as much as safe sleep, not because it's not important, just because we like to look at other areas that's going to be involved with car seats and traffic safety and things like that. So we're hoping to be able to get multiple employees trained to be certified car seat technicians, and that way we can give out car seats and install car seats, and that way we'll put our hands on more populations than just people here at the health department. We also, once we're certified, could hold the drive-through clinics where they could drive through. We can make sure their car seat's installed correctly or install it for them, and that still would be trying to minimize the percentage of infant mortality here in all 3 counties, and then of course across North Carolina. Actually, if you look at it, Terrell and Washington County currently does not have anybody certified to do the car seat, so it is extremely important to go ahead and get staff trained. That's also been put on hold because of COVID, but Lord willing, in 2021, we'll be able to send a good crew of people and go ahead and get them trained. That way we can also add that service and benefit those in the community that don't normally come to the health department.
That's some great work. work that can actually span to every other county in the state, really. So if anyone wants to hear more about how you would go about this, or pick Nicole's brains about it, or Heather when she's back, or Kirsten's on maternity leave, so I don't know when she's going to be back. But please, again, access the project write-up and get learn more about what exactly they did in the project, and also get in touch with them to collaborate and spread this work, which is so important. Nicole, thank you so much for your work. Thank you for the presentation. Thank you also to Heather and Kirsten that are not here today. Unfortunately, Heather is not feeling well. She's not well. She's on sick leave. And Kirsten, as I said, is on maternity leave. Also, congratulations on the grants. I'm really happy to hear that you received it again this year. So
Yes, we are so excited.
Yeah.
Thank you.
Congratulations. Thank you so much. And this wraps up our final presentation in the Emerging Leaders in Public Health Leadership Development Program that we in the Medical Society are very, very proud of to do in partnership with the North Carolina Public Health Association. Before all of you sign off, I just want to read out the names of the participants in this group. And for the participants, you will all receive for now, a virtual certificate, and then we will send you a certificate as well in the mail. So just be on the lookout for that. But with that, Aubrey and I, because Aubrey is in the audience and she is also equally involved in this program as my colleague and partner in crime. And we want to thank the following people for participating and for taking the time and putting the energy and efforts into this program, because, you know, we co-create the program. So it's also as much about the participant as it is about the content. But we want to thank the following individuals and congratulate them on graduating from this program. Nicole Barnes, Martin Terrell, Washington District Health Department. Kirsten Beasley, Martin Terrell, Washington District Health Department. Heather Bradley, Transylvania Public Health. Summer Curry, Davidson County Health Department. Betty Foe, Cabarrus Health Alliance. Caitlin Franklin, Richmond Department of Health and Human Services. Tarika Fuller, Cumberland County Health Department. Dana Larned, Appalachian District Health Department. Tony Locklear, Hoke County Health Department. Tammy McNeil, Richmond Department of Health and Human Services. Kelly Ransdell, National Fire Protection Association. And Jamie Todd, Cleveland County Health Department. Thank you all so much. It's been a pleasure to pass this year with you. Thank you for, we still made it happen even though it was virtual, and we can't thank you enough. And we hope that we will connect with you in some other forum soon again. And without any further ado, that wraps up our graduation, our project day presentation. And if I could, I would ask everybody to applaud this wonderful group of leaders that will change the world as we know it in terms of public health. Thank you all.